here, I'm a doctor in natural medicine and a researcher in the field of kidney health. What I want to share with you today are 5 ways to avoid dialysis with a 90% success rate, even in the advanced stages of kidney disease. But is this even possible, you may ask? Many people don't know this, but kidney disease directly causes every day more loss of life than breast cancer and prostate cancer. It's a huge epidemic that most people don't seem to care about. Unfortunately, this includes even doctors. Most doctors are still telling new kidney patients the same thing. There is nothing we can do. You will have to wait for dialysis. Well, they are wrong. There are ways to avoid dialysis even in the advanced stages and to reverse the decline of your kidney function. And I've seen people achieve this result in person. I've been working with people suffering from kidney disease for more than 10 years now, and I know very well what can make the difference. I've talked to patients who were able to lower their creatinine levels in stage 4 or even 5. And in many of my videos, I've also shared their success stories. And by the way, there is also solid scientific literature to support the fact that CKD can be stopped and even reversed, even in the advanced stages. And in this video, I want to share with you how this can be done from a practical point of view. There are 5 steps every single kidney disease patient should take if they want to avoid dialysis. Let's see them. Number 5 is take care of your vitamin intake. Vitamins are hugely underestimated way to help your kidneys. And today, research is making big steps forward when it comes to vitamins. There is a nutrient in particular with significant kidney protecting benefits that very few people have heard about. It's in this food in particular, and it is called vitamin U. Have you ever heard about it? Let me know in the comment section. But what is vitamin U and how it can protect your kidneys? Well, vitamin U is a compound mainly found in raw cabbage. This vitamin is also known as S-methylmethionine. This is a nutrient with incredible healing benefits, at the point that a concentrated juice made from cabbage may actually be beneficial in treating peptic ulcer. And this is not all. Vitamin U also helps improve digestion, lower cholesterol levels, and immune health. The reason why it is interesting for us though is another. Its kidney protecting ability. Vitamin U antioxidant, anti-inflammatory, and antifibrotic properties have demonstrated that this vitamin can produce a significant decrease in histopathological changes.
Wait. What?
Okay, but what does that even mean, you may ask? So what this study is proving is that this vitamin has an antioxidant effect so powerful it can decrease the damage oxidative stress does to the kidneys. What they observed here is that when subject to huge amount of oxidative stress, the kidneys of the test subjects who were administered this vitamin had less histopathological changes, which is a way to say kidney damage. And this is very important because even if this was a test done on animals, we must keep in mind that the way diabetes, high blood pressure, and other diseases damage the kidneys is mainly through oxidative stress, alright? Which means that vitamin U may directly protect against kidney damage. So yeah, this is a potent antioxidant you may add to your arsenal of antioxidants to get even more protection from kidney damage. Okay, but now you may ask, how can we get more of this vitamin? Well, first of all, you can get it from foods. Foods containing the most vitamin U include vegetables such as carrots, celery, parsley, green onions, asparagus, and beetroot. And cabbage in particular seems to be where we can get more of this vitamin. All these foods are great for a renal diet, by the way. All these foods have benefits of their own. And of course, vitamin U can also be supplemented. It can be found either as vitamin U or as S-methylmethionine. They are the same thing. A common dose of this vitamin used in studies is 1500 milligrams a day for 8 weeks. And vitamin U is not the only vitamin with antioxidant properties that can help you. So question, what are some antioxidants all kidney patients should use? There are many vitamins that are key for protecting the kidneys, including vitamins of the B group, vitamin D, and vitamin C. But today, some of the vitamins that are producing better results when it comes to improve your kidney function are those with antioxidant properties. Because you see, a higher antioxidant intake is actually proven to improve kidney function. Antioxidants are one of the very few treatments that can achieve this result, by the way, and that's also why vitamin U can help so much. When it comes to vitamin with antioxidant properties, maybe the most used is vitamin C. Studies show that consuming more vitamin C can increase your blood antioxidant levels by up to 30%, and that's a very effective way of protecting the kidneys. In fact, antioxidants such as vitamin C, when in high enough concentrations, can neutralize free radical molecules which in excess can damage cells inside the kidneys. This is one of the most common causes of kidney damage, as we have seen. Vitamin C is also crucial for iron absorption and to fight anemia, and it also plays a crucial role in wound healing, bone and tooth formation, and heart health. There are also studies linking vitamin C to lowered blood pressure. Remember that if you have kidney disease, you want to take 60 to 100 milligrams of vitamin C a day and no more. Now, the other vitamin with antioxidant properties is vitamin E. And vitamin E is extremely powerful as an antioxidant. Vitamin E is so effective against oxidative damage, it was used on 59 diabetic kidney disease patients in stage 3 of CKD to reverse the progression of the disease. And it also helps with proteinuria, with inflammation markers, and heart health. Now, vitamin E is not a vitamin that's usually recommended to supplement to those with CKD. This is because vitamin E is a fat-soluble vitamin. And what this means is that if supplemented in too large doses, it can accumulate. But I hope this recommendation will change in the future. I mean, vitamin E is actually pretty safe and vitamin E toxicity is very rare. But for now, a better way to get this vitamin may be from foods. Sunflower seeds in particular contain up to the 66% of your DV for vitamin E in just 1 ounce. And this amount of vitamin E may have a powerful kidney protecting benefit but without putting you at any risk. By the way, if you want to learn more about what antioxidants are, the best for your kidneys, my video up here and also down in the description is for you. But don't go away yet, there are some tips to greatly slow down kidney disease and help your kidneys that I would recommend to every single CKD patient. First of all, sleep more. Many people don't know this, but the less you sleep, the more you are at risk for kidney damage. And sleeping 7 hours or more per night is even linked to a better kidney health. Not to mention that if you sleep enough, you will have a lot more energy during the day. And also consider drinking water at regular intervals. Being dehydrated protects the kidneys in several ways, as regular water intake is needed by the kidneys to flush out excess sodium and water through urine. What not many people know is that those with diabetes need this even more. Drinking enough water may help you keep your blood sugar levels within healthy limits because excess sugar is also expelled through the urine. So unless you have a water allowance, drink more water and drink more regularly. And also make exercising a priority. Fact, regular exercise is the only thing in the world that can treat drug-resistant high blood pressure, lower cholesterol and blood sugar levels at the same time. I'm not exaggerating. I mean, if anyone could create a drug that packs the same benefits of regular exercise in a pill, they would become instant multi-billionaires. But until this happens, regular exercise is closer to a real panacea than anything else in the world. And don't forget that even walking at a brisk pace every day and taking the stairs instead of the elevator counts as exercising. And also make sure you are not actively damaging your kidney health. Okay guys, I always show you vitamins, remedies, and good habits that can protect your kidneys. However, there are some bad habits that could do damage that is orders of magnitude bigger than what any of these remedies can achieve. I'll give you some examples. Painkillers and NSAIDs. These are extremely bad for the kidneys, even at low doses. They basically cut your blood flow to the kidneys, making any chance you may have at improving vain. Smoking is also incredibly bad for the kidneys. People who smoke are routinely seen to have more proteinuria, meaning that smoking directly damages the glomeruli inside the kidneys. Same for excessive alcohol intake or eating meat and junk foods. So make sure you are not succumbing to any of these bad habits. Okay, even more important, make sure your diet is well planned and follow it every day. The renal diet is something every single kidney disease patient needs if their goal is improving their kidney function. No doubt about it. Avoid foods rich in protein and eat plant-based. Be rigorous when it comes to your diet. And if you want to know more about how to eat to protect your kidneys, please watch my recent video about it. It's up here. One last tip, measure your blood pressure and blood sugar levels regularly and write them down. When on a journey to a better kidney health, the first step is always finding ways to lower your blood pressure naturally and also your blood sugar levels if you have diabetes. Focus on progress. The question now, how can you have a 90% chance of success rate in reversing kidney disease? Now guys, it goes without saying that not every single kidney disease patient is always going to be able to, avoid renal failure. But when you combine the tips I just shown you with the other steps of today's video, you will have a much bigger chance of success with kidney health than anyone could imagine. And the reason is because now you are putting your health in first place. You are giving your body all the importance it deserves, which is something very few people actually do, really. So if you are getting informed, if you are taking steps in the direction of a better kidney health, if you are eating healthy, if you are exercising, then congratulations, you are giving your best to fight for the most important thing in life, health. And that really is all that matters. But if you think these tips are not enough for you, well, you still haven't seen the most important steps you can follow to reverse kidney disease. One is probably the most significant advancements in the field of kidney disease treatments of the last years. Before we see it, a question many of you are asking in the comment section. Can you still improve if you are on dialysis? Unfortunately, it's not common to get out of dialysis without a transplant, alright? This is not really something we should expect, unfortunately. But there have been more documented cases of dialysis patients spontaneously recovering their kidney function than most people realize. Now, this does not mean that you should refuse dialysis or a transplant if you have this possibility. But it means that, especially if you started dialysis recently, it's still worth keep looking at your creatinine levels every time you get a blood test done. Why, you may ask? As I was saying, recovering kidney function during dialysis is not common in people with CKD. It's common in those with acute kidney injury, but that's a different topic. When it comes to people with CKD in dialysis, some studies have observed that the percentage of people that improve is actually rather small, as we can see. But this also shows that there are people who improve their kidney function spontaneously during dialysis. Alright, so yeah, this can happen. Now the big problem is that most of these people are still in dialysis today. Doctors are too busy to take a look at their creatinine levels. It's not their concern if you don't need dialysis anymore. And I know this sounds terrible, but there are patients out there that are doing dialysis even if they don't need it. What to do then? Keep checking your creatinine level even if you are on dialysis already. If you see creatinine lower than 3, ask for another test and ask for your GFR to be calculated, alright? And continue to protect your residual function by avoiding medications that damage kidney and by avoiding medical dye during CT scans and MRIs. Control your blood pressure and your blood sugar. But don't worry about protein, that doesn't damage the kidneys if you do dialysis. Recovery is rare, but it is possible, and no one wants to be dialyzing 3 times a week if they didn't need to. Okay guys, time for our number 1 for today. There is only another organ in the body that can take care of removing uremic toxins. Uremic toxins are the wastes and scores that damage the kidneys, by the way, and they can be expelled either through your kidneys or they can be removed through your gut. Yes, one of the most powerful detoxing habits in the world is letting your gut removing uremic toxins instead of your kidneys. But how can we do this? Fact, according to science, probiotics can speed up the way your gut gets rid of uremic toxins. When your gut is healthy, it will be able to help consistently with getting rid of what your kidneys can't remove. Uremic toxins in particular are a great burden for your kidneys and your body, and removing them through the gut is a win-win situation. And one of the best ways to achieve this is using a prebiotic supplement. You see, prebiotics are a way to get 3 birds with 1 stone. First, they help by nourishing the good bacteria in your gut, because these bacteria don't eat carbohydrates or protein like we do. They only eat fiber, and they need a huge amount of fiber every day to thrive, much more than what 8 out of 10 people actually eat, says science. This is the first reason why you want to supplement prebiotic fiber. Second reason is gut health. Many kidney disease patients have imbalances in their gut health. Some suffer from constipation, others from bowel movements that are too frequent or watery. This is a cause of kidney damage, by the way. And believe it or not, a prebiotic fiber supplement can really help solving both these problems. Third reason, there are prebiotic supplements that will get us closer to that 90% success rate of reversing kidney disease we are aiming for. In particular, there is one prebiotic I always recommend, which is acacia fiber. This is the gum that's naturally exuded by the acacia tree. But acacia fiber won't just help by protecting your gut. Acacia fiber has the ability to actually absorb uremic toxins in the intestines. When taken orally in the therapeutic dosages around 4 to 5 tablespoons per day, acacia fiber can effectively protect the kidneys and decrease uremic symptoms by acting as an intestinal form of dialysis. In medical literature, acacia fiber was used in high doses in several end-stage renal disease patients with no residual kidney function instead of dialysis. And acacia fiber is so effective that some of them were to go on for up to 8 years without the need for dialysis. And we have also learned about the success story of one of you guys named Larry, who was able, thanks to acacia fiber, to go from stage 4 CKD to no CKD at all. And I'll talk about this story in my video up here and also down in the description. And this is all for today. Thank you for watching. God bless you all. Bye!